Imagine this. Every year, heart attacks affect over 800,000 people just in the US alone. With cardiovascular disease being the leading global cause of death, the stakes are incredibly high. The truly alarming part? A heart attack can strike anywhere, at home, in your car, or at work, often catching you completely off guard. When this critical moment hits, the actions you take within the first few seconds can dramatically swing the odds of survival in your favor. That's why we're here today. In this video, we're going to walk you through the immediate, life-saving steps you should take if you find yourself experiencing a heart attack while alone. Knowing what to do can mean the difference between life and death. So let's dive right in and arm ourselves with the knowledge that could save our lives or the lives of our loved ones. Stick around, because these tips are invaluable. Number 1. Recognize the symptoms. When it comes to heart attacks, recognizing the symptoms early on is absolutely crucial. Let's break down these key signs so you know exactly what to watch out for. The most common telltale sign is chest pain. It's not just any pain. It often feels like squeezing, fullness, or painful pressure right in the center of your chest. This pain can last for more than a few minutes, or it might go away and then come back. But a heart attack isn't always just about chest pain. You might also experience shortness of breath, which can occur before or alongside the chest discomfort. Another major red flag is nausea, which can sometimes be accompanied by lightheadedness or even fainting. And let's not forget discomfort in other areas of the upper body. This could include pain or an unusual feeling in one or both arms, the back, neck, jaw, or stomach. Understanding these symptoms is one thing, but recognizing them in real time and responding quickly is what really counts. Time is muscle. The longer a heart attack goes untreated, the more damage it does to the heart muscle, leading to potential long-term health effects. So, if you or someone you know starts exhibiting these symptoms, don't wait it out or try to tough it out. Every second counts. Acting swiftly not only increases your chances of survival, but also minimizes the potential for serious heart damage. Number 2. Call emergency services immediately. When you suspect a heart attack, the first thing you need to do is call 911, local emergency services, without any delay. This isn't the time to second-guess your symptoms or worry about false alarms. Remember, when it comes to heart attacks, it's always better to be safe than sorry. When you make that call, clarity and calmness are key. You'll need to communicate effectively with the dispatcher. Start by stating that you believe you're having a heart attack. Describe your symptoms clearly and concisely. Mention the chest pain, breathing issues, nausea, or discomfort in other areas like your arms or jaw. It's also crucial to inform them that you are alone. This will alert them to the urgency of the situation, ensuring that the response team is prepared for a forced entry if necessary. The dispatcher might also give you instructions over the phone. It's important to follow these closely and stay on the line until help arrives. They are trained to guide you through the situation and help keep you as stable as possible while the emergency team is en route. Let them do their job by giving them the information they need as soon as possible. Number 3. Take an aspirin if advised. If you suspect a heart attack, taking an aspirin could be a vital step, but it comes with important caveats. Aspirin, typically a full dose of 325 mg or 4 baby aspirins, can be a game-changer because it helps to thin the blood and reduce clotting, which is often the culprit behind a heart attack. By chewing the aspirin rather than just swallowing it, you speed up its absorption into your bloodstream, which can help minimize damage to your heart. However, proceed with caution. Aspirin isn't suitable for everyone. If you have a bleeding disorder or an aspirin allergy, taking it could be harmful. Ideally, You should have a conversation with your healthcare provider beforehand about whether you should use aspirin in an emergency. Furthermore, while aspirin can be beneficial, it should never replace calling emergency services. Think of it as a supportive measure while you wait for professional help. Your first action should always be to call for help. And then, if you have no medical reasons not to, consider taking an aspirin. Number 4. Unlock your door. In the event of a heart attack, especially when alone, every second counts. An often overlooked but crucial step is to unlock your front door. Why? It ensures that emergency responders can enter your home quickly without delay. Any time spent trying to get to you is time lost in treating you. If you feel symptoms and have already called for help, make your way to the door if it's safe and feasible. Unlock it. If you have the strength, you might even open it slightly. This speeds up access and signals that you are inside and in urgent need of help, eliminating the need for responders to force entry. Also, keep your phone accessible to communicate with the dispatcher. They may instruct you to remain on the line or guide you through additional steps until the team takes over. Number 5. Sit down, stay calm. After calling for help and unlocking the door, how you manage yourself is pivotal. The advice is to sit down and stay calm. First, find a safe, comfortable place to sit with good back support, such as a sturdy chair or against a wall. This position stabilizes your body and reduces strain on your heart. Avoid lying flat, as this can increase the heart's workload. Once seated, minimize physical movement. Unnecessary activity increases your heart's demand for oxygen. Try to stay as relaxed as possible. Panicking can exacerbate the situation, so practice deep, controlled breathing. Inhale slowly through your nose and exhale through your mouth. This helps lower your heart rate and maintain oxygen levels. Conserving energy isn't just about comfort. It's critical for preserving heart function while waiting for aid. Number 6. Do not drive yourself to the hospital. Driving yourself to the hospital during a heart attack is strongly advised against. Firstly, your ability to operate a vehicle is severely compromised by symptoms like chest pain, dizziness, and nausea. Driving puts your life and the lives of others at risk. There is also a real possibility of losing consciousness behind the wheel. Secondly, driving yourself delays medical treatment. Ambulances are equipped with life-saving tools and personnel who can begin treatment immediately upon arrival. This early intervention is often the deciding factor in survival. Time spent driving is time lost. Always call an ambulance to ensure you receive care as quickly and safely as possible. Number 7. Inform someone nearby if possible. After calling emergency services, try to alert someone nearby, a neighbor, friend, or passerby. If you can speak and have a phone, send a quick text or call someone close by. Clearly state you are having a medical emergency. If talking is difficult, use your phone's emergency SOS features to send an alert with your location. If you have a personal alarm system, use it. Even a smart speaker can be voice-activated to call for help. Letting someone know provides not just potential physical assistance, but also someone to guide medical personnel to your exact location and offer emotional support. Preventive measures for the future. Knowing how to respond is vital, but prevention is key. Risk factors include high blood pressure, high cholesterol, diabetes, obesity, smoking, and inactivity. Regular checkups help you understand and mitigate these risks. Modify your lifestyle. Diet. Focus on fruits, vegetables, whole grains, and lean proteins. Limit salt, sugar, and unhealthy fats. Exercise. Aim for at least 150 minutes of moderate activity, like brisk walking, each week. Habits. Quit smoking, limit alcohol, and manage stress through mindfulness or yoga. Be prepared. Keep your phone charged. Keep emergency medications, like nitroglycerin, accessible. Know the route to the nearest hospital. Ensure family and friends know your health status. Conclusion. To recap, recognize symptoms, call emergency services immediately, take aspirin if appropriate, unlock your door, sit down and stay calm, do not drive, and alert someone nearby. Quick recognition and action are essential. Please share this video with friends and family. Spreading awareness is key to helping others recognize and respond effectively. Don't forget to subscribe for more life-saving tips. Together, we can save lives.